Welcome to Represent NYC on the Manhattan Neighborhood Network. My name is Victoria Bird. I'm the producer of the show. And today we're going to be talking about the COVID-19 pandemic and how it's affecting us all in different ways, and specifically women. New York has taken really strong steps to flatten the curve and halt the spread of the COVID-19 virus. But it's affected different people in different way and disproportionately so for women. And today we're going to have Lieutenant Governor Kathy Hochul, who's joining us to discuss this. Thank you so much for joining us this morning.
Thank you.
Thank you. So talk to me a little bit about how this outbreak has exacerbated the normal state of affairs for women.
I thought it was interesting as this was starting to unfold to realize that we really are relying on our healthcare workers to put on their uniform in the morning and to literally go into the front lines of this war. And you realize the fact that 76% of healthcare workers are women. And they're the ones, many times, leaving a child at home, a child that otherwise would be in school, or children that could have normally been watched by parents or grandparents, but because of social distancing and the need to protect older citizens, that's not available to them. So it really just ratcheted up the stress on families, particularly women-headed households, where who's watching the kids? And also just knowing that they go in and are concerned about their own health and safety and worried about whether they're going to bring something back to the children. So I think this is an opportunity for us to, first of all, show great honor to them and to show the respect that has been long overdue to these individuals who step up, leave their families, get on public transportation many times, walk into a building at their own risk, but are doing it because they're public servants, but more than that, they're compassionate people. And I think that the rifts in society where women are historically paid less and deal with sexual harassment and domestic violence and all these other issues really come to bear right now when we are in the heat of this battle. And I wanted to just make sure that we recognize the ones who are out there literally saving people's lives. And in terms of doctors, even 40 women, the majority of doctors under the age of 50 are women. So there's a lot of women. It's not just the nurses and the healthcare aides. A lot of these are doctors again. And again, they're taking care of their kids, trying to manage all that. And I think we owe them a debt of gratitude.
You wrote a beautiful op-ed on this. I think it was in The Hill that I read it, and it was very well put. I suggest people go read it. Tell me, how is the state trying to adjust for this?
And also, I do also want to point out, it's not just the healthcare workers. When we think about the people that have been hardest hit, the waitresses, the people who work in hotels and hospitality, and the ones who are still either lost their jobs or currently the ones in the kitchens making food for our carryout. Two-thirds of minimum wage workers are also women. So they're on the front line saving lives, the healthcare workers. On the other side, they're the ones most likely to be in the jobs where they don't have the luxury to stay home. They are considered essential. They're the cashiers in the grocery stores. They're the ones still working in the pharmacies. And so this is an opportunity for us to now, but also going forward, talk about how important paid sick leave is, for example, something that the state of New York just instituted in our budget. This should be a national policy. No person should ever have to go to work sick, particularly if they're in a field where they interface with the public or are in kitchens making food or waitresses serving them. And that's been the policy up until now. So I'm proud that in the state of New York, we got that over the finish line to allow people to stay home when they're sick. And that's been a point of contention for a long time, and we got it right in New York. But I'm calling on the rest of the nation to adopt this as well. So that's one thing we did. But another thing is childcare. And I've been co-chairing a task force uncovering for the last couple of years all the barriers to women advancing in the workplace and having opportunities for other jobs and longer hours or working the night shifts. It all comes down to who's watching their children. So this crisis has put a spotlight on this, and we've had to even put up pop-up childcare centers in healthcare facilities so the children of these essential workers are being taken care of because they're not in school and they can't be taken care of by parents. So these are conversations starting now in earnest. They've been going on for a while, but I think now there'll be a heightened intensity toward resolving this as we come out of this and get the economy going again.
So it was announced yesterday that there's a pact with states on the East Coast and New York to sort of like help launch that initiative to sort of start rebuilding and opening up and restoring the economy. Can you talk a little bit about that?
Yes, and this is so important. What Governor Cuomo started with New Jersey and Connecticut, because this really is the tri-state region where there's so much synergy. I mean, people live in one state, they work in the other, their kids may go to school here, and entertainment, and there's this incredible connection between this tri-state area. But we also invited adjacent states, Pennsylvania, and Rhode Island, and Massachusetts, and Delaware, and others that are really connected to us as well, to say, as we find our way out of this, why don't we make sure that we have policies that are hopefully consistent, but at minimum are not inconsistent with each other. You don't want one state, you don't want New Jersey to open up before New York does, because then
Right.
people will just go to New Jersey for their meals or to have entertainment. And there's a lot of pent up demand. A lot of people are going to be anxious to get out the door. But as we restart the economy in phases, again, we have to caution that we are still at a plateau. We are still at a point where we cannot stop the social distancing. It must continue, or else we'll be right back where we started. And no one wants to see this bad movie replayed again. We have to get
Right.
it now. And that's why it makes sense to have a smart, cohesive strategy with our neighbors. And that's what was launched yesterday.
So, and that's really about flattening the curve. That's what you've talked about. I've seen you tweeting about that we've done it, but we don't want to sort of like create another swell, right?
You know, and people say, what do you talk about the curve? Let me show you. The number of new cases, hospitalizations, new cases, and the death rate were just going up and up and up and up. And we thought they might hit an apex and they could either head right down or they would flatten. But the good news is, even when they flatten, and sadly they have flattened at a high level, there are still high number of people whose lives have been lost, and that's something we cannot overlook in these conversations, the personal tragedy, the human toll that this is taking. But at least we're not still going up again. We've stopped that trajectory upward. So now we can manage the flow inside our hospitals and the ICUs and have enough protective equipment and ventilators, and trying to restock now so we can handle this. But we have to be so smart right now, because if we get into a sense of complacency and say, well, it sounds like the curve is flattened, the governor said the worst is over. He said the worst is over if we continue the social distancing, at least for now, until we have a chance to assess based on the numbers, the science, the data, and where we're heading, and make sure that this is one time only and we don't have to repeat this again.
Yeah, I want to just take the time to thank you too. Thank you, and thank the governor for how you've really been leaders in this time. It's been very hard to find someone to look to feel that we're being taken care of, and I wanted to just thank you. And that also goes to sort of the next thing I want to talk about, the mental health of the trauma of this experience that we're all having. You wrote some really lovely stuff about that, and have talked about how the effect that it's having on all of us.
You know, and no one's immune from this. And I don't care how tough you think you are. If for the first time in your life you lose your job, no fault of your own, but now you're at home, no income coming in, and there may or may not be children surrounding you, and then maybe a partner trying to work from home, and there's just this intense experience. Or on the other side, you're all alone. An older person who's used to getting visits and in-person interaction with kids and grandkids, and now they're isolated all alone just to protect them. But it still takes a toll on us as human beings. You know, I just came off of Easter weekend, Passover weekend, and I was really sad not to see my children who I normally would have celebrated with. So we have an emotional health hotline that I want everyone to know. There is no stigma associated with just picking up that phone. If you wake up someday and say, I just can't do this again, it's too overwhelming, I don't know where to turn, pick up the phone, and there's someone who cares and wants to help you. We have over 8,000 people who volunteered, healthcare professionals, mental health professionals, who will just talk you through the day, help you with coping strategies. But social distancing does not mean we have to be physically distant, but not socially disconnected. And that's why technology has been such a gift for people, even on their cell phones, to use FaceTime and just call people you haven't talked to in a long time. I started doing that late at night. You have old friends from college, and find a way to have that human connection to help get you through this. And don't be hard on yourself. Other people are saying, well, this is the time you have to learn a new language. You should take advanced classes. You know what? Cut yourself some slack. You don't have to clean every drawer in your house and every room in your house has at least scrubbed. You know, just understand this is a once in a lifetime, hopefully unprecedented experience, but it is a national moment. It's a communal experience because we are all going through this together, just as we experienced 9/11 and came through stronger and more appreciative of each other and appreciative of every day that we've been given. And I think that's the attitude that New Yorkers have. We are tough, but we're also compassionate, and we look out for each other. And that's what's going to get us through.
Thank you so much, Lieutenant Governor Kathy Hochul. Thank you so much for joining us.
All right. Thank you for having me. I appreciate it.
Bye-bye. Joining me now is Assemblymember Epstein. You're up in Albany, right? Tell me what's going on up there and what's happening today. Today's the day the budget is due to pass.
Yeah,
right?
so we voted on a bill last night. We'll be going back into session in a little while, voting on 3 more bills, probably through the night into tomorrow, focusing on, the things that we need to deal with: school aid, healthcare, taxes, revenue, small businesses, tenants, higher education, the whole panoply of the state budget.
Talk to me a little bit about what you're seeing in your districts and how they're being affected by the COVID-19 pandemic.
Yeah, it's terrible. I mean, across my neighborhood, across the city, we've seen the same thing. I can't imagine how 75% of our small businesses are going to make it. Stores are closed. People are already saying notices saying we're never going to reopen. There's no path for a lot of businesses. They're not making it. The rents are still going up. They have to pay their monthly rent, both the residential and the commercial tenants, and they don't know how they're going to survive. The federal government came in last week with a little support, but it's really not enough. And we've been pushing the state to do more. Unfortunately, the state has its own fiscal problems with a $10 billion shortfall right now because of the lost revenue. We need to really talk about new sources of revenue. And I've been pushing the Assembly and the Senate to push for new revenue sources. Unfortunately, we're not getting there. We're not getting support in the Senate or the Assembly or with the governor, especially with the governor, for new revenue. And we've seen revenue as the tool throughout history in New York, from the 29th to to 2008 when we have a shortfall. We ask the people who can afford more to pay more, and we're not doing that this year.
Now, tell me what kind of pushback you're getting when you ask for this, when you ask for, more revenue from on a state level or on a federal level ultimately,
Right.
but on a state, what's the pushback?
Well, they're saying, well, people look how poorly the market is doing. Those people have less, so they're not doing as well. But the reality is that they are. They still have the federal dollars that they've got a tax cut from. They still are doing better than most people. They can pay their mortgage and their rent and their summer home and their cottage and their private school and their tutors. And their day-to-day folks are just not going to make it, and we're going to see evictions. So if we're going to continue to cut money, that's what's going to result.
Your district is the Lower East Side,
Yes,
and there's a lot of public housing there as well.
correct.
I know there has been a lot of push for rent freezes, rent moratoriums, rent
Right.
forgiveness. Where have you been in this battle? What have you been?
So there's a couple of bills out there. I sponsor a bill around rent freezes because we need to not see increases in rent. I co-sponsor another bill along with Assemblywoman New around 3 months of rent forgiveness. We are also talking about other tools that are available, trying to give commercial give back, saying, well, if a landlord forgives a commercial tenant their rent, they can do a tax abatement for the landlord, so it won't be a cost to the landlord. There are a lot of tools available in our tool belt. We just need to start using them, and we aren't using them today.
Tell me a little bit about the hospital relief and dealing with the shortage of
Right.
protective equipment.
Yeah, it's terrible. I mean, the hospitals are struggling every single day. We've seen in the news every day about Elmhurst Hospital. In my district is Bellevue Hospital, one of the most important H&H facilities in the country and in the state, but also best hospitals in the country. And we're seeing shortages. I heard from residents and nurses saying they don't have PPE equipment. They're struggling every single day. And so we don't have enough equipment. We heard a big shipment yesterday from the governor's office, but we need more. We need more support for our doctors and our nurses. And at the same time, we're talking about the governor's push for $2.5 billion cuts. And that'll have impact not just on our H&H and our health and hospitals, but all our healthcare facilities. One of the facilities by me, Ryan Health, has got a clinic that will lose millions of dollars if these cuts go through.
Mm.
We can't, in this global pandemic, support more cuts.
Your office is physically closed, right? Your office downtown.
Yes,
But
everyone's working remotely.
how can people get in touch with your office?
Yeah, they could. They can email, they can call. They can call us 212-979-9696. They can email at help@district74@gmail.com. If people know I'm in the 74th Assembly District, they can email me at harvey.district74@gmail.com. They can reach out on social media at Harvey for New York on Twitter, Facebook, Instagram, and we follow it. We can respond to people and talk to people. What my most important message is if people have a problem, we've heard a lot of people having problems with unemployment insurance, reach out. We can help. We can help navigate this complicated system. Average week in New York is 50,000 people apply for unemployment. Last week, it was 1.7 million. And so the phones are just going off the hook. So people can't get through. It's frustrating, but don't give up. It's not from the date that you apply. It's from the date you lost your job. So if you can't get through, keep trying. You can't keep trying, call my office or your other local member, and we will help you.
What are some of the things that you might be working on that aren't COVID-19 related that you really want people to know about?
Yeah, well, there's so much that we're trying to work on. It's just hard in the context of the budget. There's all the COVID-19 things around education and higher education. People not have access to the technology they need. We hear from our students, both in education and higher education, that have problems with the food insecurity, the housing insecurity. Those will continue. But we also have to think about longer term struggles. We all talk about how we have budget equity. So a big piece that I'm working on this year is to force budget equity into the conversation. And we've been talking about how those who can afford more should pay more. An example is what's called a mezzanine debt tax bill, which says that if I go buy a home and you want to go buy a home, let's say we want to buy the same home, you get private equity money from a private equity source. Someone gives you $300,000. You can go to the purchaser and say, "Hey, I have $300,000 in cash. I want to buy this home. I want to buy the same home." And I'm like, "Well, give me 60 days. I'll have to go get a mortgage. And when I get the mortgage, then I'll be able to purchase a home. Who's the homeowner going to choose? Obviously you, because you have cash on hand. So what private equity money is doing is making it harder for regular people to purchase homes. We do no regulations and no oversight of private equity funds. We have no idea how much money is in the system. We have no idea how it's impacting the real estate market. So I want oversight. I want to tax private equity money the same as I, as a homeowner, would get taxed. If I file a mortgage, I have a mortgage recording tax. Private equity money has no tax. So we want oversight and regulations over this $1 billion industry to ensure that we have more revenue coming in, which I think will be another $4 billion, plus oversight of an industry that has very little oversight. So the issue after issue like that, sorry for all the details, but there are so many important issues out there just like that we're trying to grapple with every single day.
And it's so difficult because it really is, we're experiencing something that we've never had before that's just taking over everything.
Right.
And
Taking over.
other things are still happening. Other things are still need to be addressed, but obviously they're being dwarfed by COVID-19. Is there a way that you want to tell people to stay up to date on what's happening?
Yeah, I think people should stay up to date. They can follow me on Facebook, Twitter, and Instagram. They should go out, fill out their census form if they haven't done it already, because it's so important to get the census done. And they should reach out. So important to call and email us to let us know what's going on for you, because that's how we have the impact on change. If we don't hear from you, we don't know what's happening, and we can't make that change. We can't make things better.
Assemblymember, thank you so much for joining us. I really appreciate you taking the time.
Thank you for taking the time, and be safe yourself, okay?
You too. Okay.
Thank you.
Bye.
Bye-bye.
Here in New York City, you know, we also don't want to just be sitting at home. We want to try to see how we can help others and how we can help other people. So we reached out to a foundation that's been doing some work in the city that we really find interesting. I'm here with Mary Grace Pagduan, and she's with the Afia Foundation. Mary Grace, so nice to meet you.
So wonderful to meet you. Thank you so much, Victoria, for having me here today.
Tell me a little bit about the Afia Foundation.
Sure. So the Afia Foundation was started 11 years ago by Danielle Butin, and we collect and rescue surplus medical supplies from all the area hospitals in the tri-state area, as well as hospice centers, nursing homes, and private residences. We bring them to this warehouse. We then sort through them and then pack them again and then send them overseas to medically underserved communities, mainly in Africa and the Caribbean.
But now that we are sort of having a great need for medical supplies here in New York City, how are you working with New York City hospitals, and do you work with individuals as well, or individual practices, or tell me how that works?
Sure. So for the past few weeks, we have received multiple requests for PPEs, and that's personal protection equipment for frontline healthcare workers. So we are fulfilling those needs. We have N95 masks, we have gowns, we have gloves, any PPEs that we have here. We are doing our best to fulfill all the requests that we're getting. So we have some in stock here at the warehouse. We are also accepting donations. So very, very generous people from all over the country have been sending us their PPEs that they have stored in their kitchen drawer, or a lot of artists who use masks, as well as dentists and art teachers and art students. So it's been really, really wonderful. We've been receiving individual donations. We have a campaign for $6 for 2 N95 masks, and people have been sending us money so we can purchase the N95s. Eye protection, people have been sending us their goggles or their work eyepieces that they use, as well as hand sanitizers or Sani wipes. So that's been really, really wonderful, as well as gloves. People have also been sending us their gloves.
So obviously these things haven't been used. Do they need to be in the bags? Do they need to be in wrappers?
Yep. So we'll take opened boxes or containers, that's fine. And we then send them and try and fulfill as many requests that we get from hospitals for their frontline healthcare providers.
And how, and people can also donate monetarily as well?
Exactly. So we have a campaign going on now. If you go on our website, afiafoundation.org, we are requesting $6 to purchase 2 N95 masks for all the providers. We've identified a vendor that is providing us with very, very reasonable at reasonable cost for these masks. And so since we started the campaign, we've raised almost $40,000 to purchase the masks.
I really want to thank you so much for joining us today. I know you're very busy, and I hope that you're doing such great work, because you're really helping the people who are on the front lines protect themselves, and that's really amazing. Thank you so much.
Thank you so much. Have a great day, Victoria.
Thank you. Bye. Thank you for watching Represent NYC on the Manhattan Neighborhood Network. My name is Victoria Burt. Stay safe, stay healthy. Bye-bye.